assure you that your mornings will definitely feel better. Kick off your day with the Carnival Breakfast Show, Mondays through Fridays, 8 a.m. to 11 a.m. Absolute radio for the funnest way to start your day. The Carnival Breakfast Show. Dig it.
Good morning, everyone, and welcome to Carnival Breakfast Show. This is Newspaper Review. I am Ibrahim Adebayo. Funding preventive measures. We break drug abuse vicious circle. Tinubu. Cholera, FG shopping for emergency vaccine. Knox, kudos as Southwest governors adopt anthem for region. Insecurity, bane of food shortage, says Institute. NCDC chief warns of possible state of emergency on cholera. Rivers crisis, probe Wike protesters attempting to bomb hotel in Port Harcourt. Fubara alleges. Now the news in details. President Bola Tinubu yesterday expressed dismay over havoc of drug abuse on individuals and families. According to him, funding evidence-based preventive measures will save lives and conserve resources that will otherwise be used on treatment and rehabilitation. President Bola Tinubu, in his keynote address at the commemoration of the World Drug Day at the Presidential Villa, Abuja, said the theme of the commemoration, the evidence is clear, invest in prevention, underscored the imperative to commit more resources in the collective and coordinated quest to stamp out the consequences of abuse of illicit drug. The president, who was represented by the Secretary to the Government of the Federation, SDF, George Akume, commended organizations, communities, and individuals in the country working towards preventing drug abuse and its associated harms. According to him, illicit drugs and substances have wreaked havoc on individuals, families, communities, and countries worldwide. He said the socio-economic and health consequences of drug abuse were not only devastating to lives, but also a strain on healthcare system. Tinubu said drug abuse imposes a burden on government and people, and the ramifications of its consequences reverberate across generations. In the face of such a formidable challenge, prevention is the most potent weapon that we can deploy. Prevention not only saves lives, it also saves resources that would otherwise be spent on treatment and rehabilitation. It empowers individuals to make informed choices promote healthy lifestyle, and create a resilient community capable of withstanding the pressure of drug abuse. Funding preventive measures will break drug abuse vicious circle. Tinubu. For more details on the news, you can visit the Vanguard newspaper. Cholera. FG shopping for emergency vaccine. In the wake of the cholera outbreak in the country, the federal government yesterday initiated dialogue with the Global Alliance for Vaccine and Immunization, Gavi, to obtain emergency supply of oral cholera vaccine, OCV, as Nigerian battle the disease amid a global shortage of vaccine. Director General of the Nigerian Center for Disease Control and Prevention, NCDC, Dr. Jide Idris, who disclosed this in Abuja, said the coordinating Minister of Health and Social Welfare, Professor Muhammad Ali Pate, is leading the discussion with Gavi. The development came as NCDC announced an increase in the death tolls and spread of disease across 32 states and 115 local government area of the federations. Nigeria utilizes 3 World Health Organization pre-qualification oral cholera vaccines, including the Quran, Sanko, and Evichok Plus. 2 doses of any of the 3 vaccines are required for full protection and administered only to persons and groups at risk, such as travelers to area with active cholera transmission or people living in the area experiencing outbreak. On the quest for emergency dose of cholera vaccine, Idris said Gavi, a global health partnership, plays a pivotal role in improving access to vaccine in low-income countries. Through negotiation, Nigeria aims to secure emergency supply of cholera vaccine to curb the outbreak. Idris further explained that there is a surge in global demand for cholera vaccines, leading to severe shortage, even though he noted that the limited supply has strained efforts to control outbreak in the endemic region, including Nigeria. Poor sanitation, inadequate clean water supply, and limited healthcare infrastructure have exacerbated the spread of the disease. But in response to the crisis, the NCDC has intensified its public health campaign, emphasizing hygienic practices and importance of clean water. However, these measures alone are insufficient without adequate vaccination coverage. The shortage of vaccine has hampered mass immunization campaign, crucial for preventing the spread of cholera. The situation in Nigeria underscores broader issue of global health quality and preparedness. It highlights the necessity for increased vaccine production and distribution infrastructure investment, while noting that more vaccines were being ordered because of the scale of the problem. The NCDC DG called for stronger international collaboration to ensure life-saving reach the most vulnerable population promptly. For more details on the news, you can visit the Vanguard newspaper. Cholera, FG shopping for emergency vaccine. Knox, kudos as Southwest governors adopt anthem for region. The 6 governors of the Southwest state in Nigeria. under the auspices of Southwest Governors Forum, adopt anthem for the region. Governor Babajide Sanwo-Olu of Lagos State, Lucky Ayedatiwa Ondo State, Dapo Abiodun, Seyi Makinde of Oyo, Ademola Adeleke of Osun, and Biodun Oyebamiji of Ekiti attended the meeting. At the meeting, the governors unanimously and officially adopt the anthem for the region. The adoption of the new Yoruba anthem has continued to generate reactions from stakeholders in the region. While some see it as a misplaced priority, others see it as a good step towards realization of regional government, which the Southwest has been in the forefront of. The former chairman, Trade Unions Congress, Ekiti State Chapter, Mr. Kola Wole Olaiya, described the new region anthem as misplaced priority, adding that the Southwest governors should prioritize the welfare and security of the citizen by coming up with acceptable minimum wage. The Pan-Yoruba Socio-Political Group Organization, Afenifere, said that the adoption of the anthem signifies a resolve by the Southwest government that our region will be marching forward with unity of purpose. Afenifere National Publicity Secretary Jari Ajayi commended the governors for having a good sense of history, as he recalled that the anthem was composed by the defunct Union Party of Nigeria (UPN) under the leadership of late Obafemi Awolowo. Indeed, it was Chief Obafemi Awolowo who composed the anthem and asked Chief Hubert Ogunde, the renowned artist, to give the anthem a melody. Ogun State government, under the late Chief Olabisi Onabanjo, adopted the anthem. Osun State did the same when Ogbeni Rahuf Aregbesola was governor. Late Arakunrin Akeredolu followed suit by adopting it for Ondo State. This is, however, was the first time that all government in the Southwest region will adopt a common anthem. The uniqueness of the anthem is not only in the exultative word it contains, but also in the fact that it is a native language of the people, Yoruba. Ajayi further urged the governors to ensure that the anthem is learnt and recited by students in all Yoruba-speaking area and beyond. When contacted, the convener of Yoruba Committed Forum, YCF, Otumba Tayo Onayemi, said the Yoruba anthem was not the initiative of the Southwest governor, but of Afenifere. Also speaking, the Publicity Secretary of the PDP in Ondo State, Mr. Kennedy Perepetes, said the Southwest governor in the recent times has been subtly pushing for a return to regional government. The step may get towards its realization. For more details on the news, you can visit the Vanguard newspaper. Knox kudos as Southwest governors adopt anthem for region. Insecurity, bane of food shortage, says institution. Members of the Nigerian Institute of Science and Technology in Lagos State have said that insecurity is the bane of food shortage. They spoke at the 10th Regional Food Science and Technology Summit. About 400 professionals attended the event. A quiz competition debate lecture was held among secondary school lectures and panel session and exhibition pavilion. Chairman of the event is the Divisional Marketing Director of Food Division at Flour Mill Nigeria PLC, Ilhaz Kazim, while Oluyemi Oloye, the Managing Director of UAC PLC, is the keynote speaker, the founder of the Paisari International Company Limited, Mrs. Oluyemi Iroloye. The special guest of honor, food science experts showcase knowledge and discovery to the audience comprising professional research students and enthusiasts from the food industry. At the event also were NAFDAC, FIRO, and others. Monte Tops University came first in the quiz. Obafemi Awolowo University and University of Ibadan came second and third respectively. Insecurity, bane of food shortage, says Institute. NCDC chief warns of possible state of emergency on cholera. The Director General of Nigerian Center for Disease Control and Prevention, Dr. Jide Idris, has said a state of emergency may be declared for cholera if cases exceed a controllable level. Idris spoke during Adetokunbo Alakija Memorial Travel Medicine Lecture at the Civic Center, Victoria Island, organized by Nigerian Society of Travel Medicine. He said, based on the data to be obtained from partners in the assessment, if they look at the data and they decide the situation has gone beyond a particular threshold, then we call it an emergency situation. He said the agency was still awaiting report from team conducting investigation. Dr. Idris noted cholera is a result of lack of access to potable water, environmental sanitation, and personal hygiene. He said government ought to provide clean water and sanitary facilities for people. A lot of these diseases occur in the slum area where there is poverty, poor drainage, poor personal hygiene. So these are the issues. The government should play its role and the people play theirs. The government is putting priority on health care, governance, leadership, service delivery, supplies change issue, and health security. The managing director of Haxal Masa Health Limited, Tokwe Adeniyi, advised traveling citizens to invest in health insurance. This, he said, will enable them to stay protected in case of emergency health care. Also, preventive issues, measures, nutrition requests, and lifestyle. We need to look at food to recommend to Nigeria to prevent diseases. President of NLSTM, Dr. Nkechi Ilodibia, said the event was a memorial to mark the legacy of Alakija while creating awareness on how to promote medicine in Nigeria globally. Before we bring the newspaper review to a close, here are the headlines again. Funding preventive measures. We break drug abuse feature circle. Cholera. FG shopping for emergency vaccine. Knox kudos as Southwest governors adopt anthem for region. Insecurity. Bane of food shortage, said Institute. NCDC chief warns of possible state of emergency on cholera. And that ends the newspaper review on Carnival Radio. Thank you for listening. I am Ibrahim Adebayo. You can download the Carnival Media app on Google Play Store and iOS App Store. Enjoy the rest of your day.